There is something that no one discusses when it's come to moving abroad as a nurse. The challenge of cultural shock and what I refer to nursing shock. Cultural shock is a common experience for anyone who moves to another country. In fact, 100% of people who move abroad experience cultural shock. It can be caused by a variety of factors including differences in language, culture, costume, and values. This happens also to people who have already moved abroad before, because it also varies based on age. For nurses, cultural shock can be particularly challenging. In fact, nurses also experience nursing shock, which I refer to as a cultural shock in nursing practice. I invented this term. Being in the global nurses market for 8 years now, I realized that cultural shock occurs in the nursing profession itself, so I wanted to call it phenomenon like nursing shock. What's up, everybody? Welcome to Nurses Move, the channel dedicated to all nurses who want to move abroad to live the best life in the place on the planet they love the most. I'm Nurse Tina. I'm an expat nurse myself and an international career coach for nurses. And today I'll talk you too about the challenges of cultural shock and nursing shock. And this is because nursing is a profession that is deeply rooted in a culture. The way we deliver care, the way we interact with patients and family, and the way we do our role are all influenced by our culture. And this is why there are different country by country. When we move to a new country, we have to learn and to adapt to a new way of doing things. And this can be a very difficult and frustrating process, guarantee you. If you are a nurse interested in moving abroad, don't be scared, but stay tuned because I will provide for you tips on how to reduce the landing crash, how to overcome cultural shock in nursing practice or nursing shock, and why it is so important to study the scope of practice before moving abroad to preserve your mental health. So let's have a look to cultural shock and define it. So cultural shock is a common experience for anyone who moves to a new country, as we already said. It can be caused by a variety of factors, including difference in language, culture, custom, and values in general. For nurses, cultural shock can be particularly challenging. And this is because nursing itself is a very challenging profession. So we add another layer on these difficulties. One of the biggest challenges of cultural shock for nurses is the language barrier. If you don't speak the language of the country you are moving to, it will be very difficult to communicate with your patients, colleagues, and supervisor. So most countries offer language courses when you sign the contract for the nursing job there, such as Germany, for example, or Holland. But when it's come to passing a language test, more nurses fail this test and need to retake it more than once. Tests of language can be challenging due to the structure rather than the difficulty of the language. Therefore, I recommend hiring a test coach rather than a language teacher. The difficulty of communication is not only in learning the new language, but also understanding slangs and dialects, as well as when people use idiomatic expression, which are difficult to understand. If you don't know it, you don't know it. Learning the local language, or at least learning basic conversational skills, is essential for international nurses. In addition to establish trust with patients, you foster effective collaboration with colleagues and ensure accurate understanding of medical terminology when you overcome language barriers. Nurses can also better understand the culture of their patient when they are able to communicate in their native language. Cultural differences. In addition to learn new custom and belief, working a different culture involves adapting to new communication style, understanding non-verbal cues, and navigate international dynamic in order to provide effective patient-centered care. It is essential to embrace cultural sensitivity and develop cross-cultural competencies. Without these skills, It can be difficult to build trusting relationship with patients from diverse culture. But by understanding and embracing cultural differences, healthcare providers can ensure that their patients feel heard, respect, and that their care is tailored to their need and belief. In order to build your cultural nursing competence, I create a special playlist containing interviews with nursing leaders, innovators, and coaches. You can find the playlist below by clicking on the description box. We will also have the opportunity to participate in the conversation by joining our private Facebook community, Nurses Move Mastermind. By asking your question live, you can be part of the interview. The link as well is in the box below. So, different healthcare system. Every country has their own healthcare system policies and practices. International nurses must familiarize themselves with local protocol, procedure, and documentation requirements when transitioning in a new healthcare system. Delivering safe and quality care involve adapting to different electronic health record system as well, medication administration practices, and interdisciplinary collaboration models. It is essential for international nurses to be able to quickly learn and implement new protocols and systems, as well as understand the culture and value of the healthcare system to ensure patients receive the best possible care. Understanding the legal and ethical responsibilities of nurses within the new healthcare system is also important because it could be very easy to lose your license. You can see that the first 4 points are very much related to integrating into a different culture, which is why choosing a culture that is compatible with your goals and needs is so important in your new career and life abroad. Additionally, it can be difficult for international nurses to start their career because they come from different backgrounds and do not know how to prepare a CV, apply for a job, pass an interview in the new country. Hence, I create Successful Expat Nurse Accelerator, an online program that helps nurses move abroad safely and strategically so they can achieve successful abroad, enjoy the lifestyle they always dream of, and be productive in their career. If you want to know more about, you can check out the link in the description box below. Now, I give you tips, a few things you can do to reduce cultural shock. First of all, choose the right country to move to. You are a person with personal needs and you're a professional with professional needs and career expectation. Every country can offer something different in terms of living and in nursing practice. Do your research and find the best country for you that is aligned with your way of living and it is able to satisfy your personal and professional needs. Don't take a country just because it can give you a job, a salary, or just because it has a different weather. Second, try to learn as much as you can about the country you're moving to before you go. This will help you to understand the culture and custom, and it will make it easier to adjust when you arrive. Third, try to connect to other nurses who have moved to the same country. They can share with you their experience and their point of view to better understand the process. International career coaches are even better, especially if they themselves are expert nurses, because an expert international career coach, which is also expert nurse, they have all the comprehensive knowledge to help you make the transition to a new life and a job abroad. They can provide you with advice and support, and they can assist you with navigating the healthcare system. If you choose me, I guarantee you that the transition will be safe, strategic, and in line with your preferences. Do you want to know more? Link is in the description below. Let's go with the fourth tips. Once abroad, don't be afraid to ask for help. Do not be afraid to ask for help from your colleagues, supervisor, or therapist if you have having trouble adjusting. We are human, and especially in some place, if you choose your job properly and you find a hospital organization that in line with your vision but is also care for the employer, for sure you have resources to utilize that help you to overcome your emotional threats and difficulties. So ask for help. We are human. Please consider to subscribe if you enjoyed this video and if you found the information I share with you helpful and valuable. It motivates me to keep continuing creating this content, and if you are considering subscribe, it fills my heart with joy as you are telling me that you trust me, which I greatly appreciate it. Thank you. Okay, now I want to tell you how overcome cultural shock in nursing practice. It is also very important to study the scope of practice in the country you are moving to. This will help you to understand what is expected of you as a nurse in that country. The scope of practice can vary from country to country. In some countries, nurses are more autonomy than in others. It is important to understand what your role will be before you move, because it could be frustrating if you move in another country and you don't have the autonomy or the safety that you want to have or that you are used to. Choosing the right nursing practice is important before you move. Learning about the different nursing scope of practice in different countries will allow you to determine which is the best country for you. If you already have done these steps, you are already in a safe space. You will need to learn to adapt to the different way of doing things when you arrive in your country. Although this can be challenging, remember that you are not alone. I will share with you a few ways in which nurses can overcome cultural shock while practicing abroad. But first, I would really appreciate if you give me a like. This will give a boost to this video so that other nurses can enjoy it. Please, thank you very much for doing that. The first step to overcome cultural shock and nursing shock is to be open-minded and willing to learn. Don't assume that your way is the only way to do things, especially if you are a seasoned nurse with experience and background in your country. When I move abroad, I have already 12 years experience in my country, and I have already covered different roles. ICU nurse, emergency nurse, nurse educator, nurse in charge, and nurse manager. Upon moving abroad to the UK, I have to start as a new nurse and learn to do things differently. Even drugs that we used to use for something in Italy were used for something different in UK. In Italy, we use cathaprezan, clonidine, for example, in ICU to reduce blood pressure. In UK, we use for delirium patients to reduce symptoms of delirium and in certain way to withdraw from opioids. See? You have to be open-minded in order to learn new things and, more importantly, to adapt in the new healthcare system. Secondly, respect the culture, norm, and custom of the new country, both inside and outside the hospital. In this way, you will be able to build a relationship with patients, colleagues, supervisors, and people in your community. Be respectful if you want to be respected. Third, take your time. Adapting to a new culture takes time. You won't become an expert overnight. Take it easy. Give yourself time. And most importantly, be compassionate and understanding with yourself. All of us have different background. Each of us come from different experiences, different countries, and different personal circumstances. Each of us have a different timing in adapting in a new country. The more you study before you move, the best is your adaptation in the new country. Take your time, respect yourself, be compassionate with yourself, and just willing to grow, remaining open-minded. So the fourth tip is to avoid overworking. I know maybe none of you will agree with this. I know that you need money, I need money too. But if you overwork, will leave you exhausted and depleted of energy. As you are not in your used environment, you don't operate on your autopilot anymore like you used to do when you were at home in your own country. You need to rest to be able to adapt in a new country, especially in the first 6 months to 1 year. And this is so important because you can make mistakes and you can lose your license very quickly. So don't overwork. Be sure that you're rested well so you're able to learn with peace of mind at your time, with your pace, and without or reducing mistake. And this will lead me to the following. The fifth point is to embrace a minimalist lifestyle that you overcome cultural shock and nursing shock. And I'll explain you why. Everything could happen abroad and you need a parachute. You need to save as much as money as possible. There is no need to you to impress anyone, since nobody knows you yet and no one's care about you. And who is at home don't know about how you live in a new country. In the beginning, this could be a good thing, aside it gives you the freedom to adjust in a new environment without worrying about the others. Thinking about. So you don't need to overwork because you don't need to impress anyone. You need to put money aside. So keeping a minimalist lifestyle can help you to achieve this goal. Cultural shock is a common experience for anyone who moves to a new country. However, there are things you can do to reduce and overcoming cultural shock. By being open-minded, respectful, and patient, you can successfully adjust in your new life and career. But choosing the best country for you where to move for having your best life and work experience is the best first strategy that you can apply. And this is why I made this next video that I invite you to watch. I hope this video was helpful, and if you have any questions, please leave them in the comment box below. Thank you very much for watching, and if you want to know more about how to choose the best country to move into, check out this video and I will see you there. Bye. Take care.